All right, we're just after 7 o'clock here. So I will turn my camera on and I guess we will get going with everything here tonight. Thank you everyone for joining us again on another long-term care family call. My name is Rob Hatton. I'm the communications manager with Grey County. And joining us on the call tonight is Jennifer Cornell, Grey County's Director of Long-Term Care and Senior Services, as well as Denna Leach, Grey County's clinical specialist for our long-term care homes. We're going to follow the same format that we usually do tonight, but after Jen and Denna speak, we will have a special guest presentation tonight as well from some representatives with Silver Fox, our new pharmacy at the homes. So we're looking forward to that. And just before we do jump in to start our call, I just want to let everybody know that we are recording the call tonight as we usually do. We'll circulate a recording in our follow-up email following the call tonight. Once we get through the presentations, we'll go to a Q&A portion of the call. So if anything does come up or you have any questions, please do use the Q&A feature that's along the bottom of your screen on Zoom there. It just makes it easier for us to keep track of everything to make sure we don't miss anything, and we'll get to as many as we can tonight. If there is anything that comes to mind following the call, you can always reply to our newsletter emails. Those come to me, and we will try to respond to your question as soon as possible. And just for the sake of everyone watching along tonight or recording, this is going up on July the 2nd, and the call is specifically for the 3 long-term care homes that are owned and operated by Grey County. So with that housekeeping out of the way, I will pass it over to Jennifer Cornell.
Great, thanks, Rob. Good evening, everyone, and thanks so much for joining us tonight. Rob just introduced me. I'm the Director of Long-Term Care for Grey County's 3 long-term care homes, Grey Gables in Markdale, Lee Manor in Owen Sound, and Rockwood Terrace in Durham. We last met virtually on March 26th, which just seems like a blink ago, but at least the snow has finally stopped now, I think it's safe to say. So for tonight's update, we have some Ministry of Long-Term Care announcements, a couple of Grey County updates. Denna is going to give an overview on our approach to measles, and as Rob mentioned, an introduction and some information from our partners at Silver Fox. So for the ministry announcements, the legislation, we've talked about this a few times over the last number of months. The legislation that is called Supporting Seniors and Caregivers Act has been brought forward again. We're watching for updates and we'll keep you posted. 3 key areas with this legislation focus on improving dementia care and supports, supporting seniors, their families and caregivers, and protecting seniors and enhancing social connections. So there's a lot in this piece of legislation. It was originally tabled before the election. Once we went into election, all legislation that was tabled what kind of was done, and then the government's been bringing back legislation that they're moving through the process. So this is one of those. In addition to that, there was the annual increase to accommodation rates came into effect on July 1st. So you will have received a notice about this the beginning of June. These rates are set by the Ministry of Long-Term Care and apply to all long-term care homes in Ontario. If your loved one is part of the rate reduction program, make sure that the most recent copy of their notice of assessment has been dropped off to the office coordinator at your home. Grey County updates. Karen Kraus is the current executive director at Rockwood Terrace, has accepted the role of project lead for operational readiness for the Rockwood Terrace redevelopment. In this role, Karen will coordinate cross-functional teams, support change management, and ensure that key operational frameworks such as staffing models, training programs, and resident care protocols are in place and aligned with our standards of excellence. A key priority is embedding our Color It Your Way philosophy into all aspects of the new home. And Karen is also assisting with the recruitment and onboarding of the new executive director for Rockwood Terrace, and we're in that process right now. And that I was going to say it sounds easy when you say it fast, but I don't think it does. So we're really thankful for Karen to step into this really important role in this next phase of getting ready to be able to move into the new Rockwood Terrace at the end of 2026 or beginning of 2027. This item has been highlighted in our newsletters, but it's always good to take an opportunity to share amazing news. So I'm really pleased to share with everyone, maybe again, that the Grey County Long-Term Care Color It Coach program, which we do in partnership with PrEP LTC, has been honored to receive the prestigious Advantage Ontario Innovation and Excellence in the Workplace Quality Award for outstanding work. And some of the leaders from the three homes, as well as Color It Coach captains. So those are team members from each of the homes who have taken on an additional role in the Color It Coach program, joined me in Toronto in May to be able to receive this award. And it was such an honor and such a great opportunity to recognize the work of the teams in the home. And now I'm going to pass it over to Dana Leach, our clinical specialist, and she is going to share an update on measles, which we're hearing lots about, and the Grey County approach.
Thank you, Jen. Just giving myself a minute here to share my screen, and if you wouldn't mind to let me know that you can see it.
Yep, looks good.
Okay, thank you. And thanks everyone for who's listening right now live. I know it's 26 degrees and many might be outside enjoying the weather. So for those of you who are listening to the recording, just recalling that what I'm sharing is related to the July 2nd timeframe. So I want to give you a bit of a measles update, and I'll start by sharing just the current measles risk, and this has been identified by our ministry partners. In terms of our area, the majority of the cases are in southwestern Ontario, in terms of Ontario, primarily amongst those unvaccinated or under-vaccinated children. And it's about timing, but it's also about the number of doses. So the risks to our residents, to those of us in long-term care homes, is considered extremely low. As most people before 1970 do have immunity. The current risk to unimmunized staff, family members, and visitors, as well as residents born after 1970, is where we are concerned about the risk, particularly in southwestern Ontario, where the cases are the highest. Now, we were seeing very high numbers, and when we spoke with our public health partners, they did advise last week that the numbers are starting to get a little bit lower, and that's, I think, because there are many people who are working very hard to get vaccine into arms, as well as everybody's checking their status for sure. So, and just in terms of what is measles, it's very contagious. It's a respiratory infection caused by a virus. It can spread to others either 4 days before the rash, up to 4 days after, and that time frame is variable. But generally speaking, even before you have symptoms, you can be spreading the virus. The virus is spread through the air, coughs and sneezes, even hours after no one's any longer in the room. And that some of you may have been seeing some alerts from public health that saying those people who may have been at this doctor's office or in this hospital waiting room may have been exposed. So definitely keeping in mind when you are in those places, certainly masking is an option if you're not well or you're in a place where people are not well, such as those waiting rooms. Vaccination is the most effective way to limit the spread of measles and protect not only you, but those around you. And as we're working with our residents and their well-being is the most important to us, that we want to ensure that families and friends coming in and are vaccinated, or at least reducing their risk to those spreading the vaccine around them. Because although some people think that measles, if we get measles, you'll build your lifelong immunity, why not get exposed? But there is a risk that there are complications up to 10% of folks with who do get measles, and that's pneumonia, encephalitis, or other infections. So that myth that it's good to get exposed. I think back in the day when they talked about chickenpox parties, there was some thoughts of that about that as well with measles, but that is not the case. The risk is too high. Vaccination and knowing your status is really important. And just by way of symptoms, so how do we know that we are at risk? So symptoms may present as a fever, respiratory symptoms, pink eye, a rash, and they can begin in the face and spread downwards. That's typical, although there can be some unusual ways it happens. But it's typically 3 to 5 days after the onset of those prodromal symptoms. It's like sort of you just don't feel well. That's what that means. You can't really determine what you just don't feel well. And so that's why we're encouraging our staff, visitors, if you're not well, to stay home. That just gives you some pictorials of what the symptoms look like. So I wanted to let you know what we're doing at all three of our long-term care homes. Communicating. We're talking like today, asking, sharing the message that there is a risk in the Southwestern Ontario in particular, but we're also talking to our staff to know their vaccine status in case of an exposure. Healthcare workers require 2 documented doses or a teeter showing immunity. So we've been talking a lot with our team about that. We're leading by example. Our leadership teams are sharing how they've determined their status, knowing their vaccine status. We're talking about signs and symptoms education. We're doing lots of huddles with our teams and answering their questions and describing what the current state is of measles and what we need to do to support and keep our residents and staff healthy. We're doing, our IPAC practices. We're reinforcing infection prevention and control. Again, I reiterate, we're encouraging people to stay home if they're ill. We're encouraging vaccination of all of our staff members and sharing how they can get that vaccine at their family doctor or public health clinics. We're monitoring symptoms. We do that daily. We do that on every shift. For our team members coming in to see how they're doing, and if there's any, have any illness, we follow that up as well. But of course, we're looking to our residents to making sure they're healthy every single day with every single team member. And then we work in the event that we do have measles exposures. We talked with everybody in terms of our outbreak protocol. We have staffing plans and how we would manage in the event there was an outbreak. Again, prevention is where we want to be. But in the event that we have to go there, we have our plans in place. And again, working with our public health partners in preparation. This is a poster that we created that's on the bulletin boards of our staff, again, knowing the measles vaccine status, how they can find out with their immunization record and checking their public health website. So a reminder to our team that they need 2 doses of measles vaccine or lab confirmed evidence of immunity to work with our residents in the event of a measles outbreak. So I wanted to share that. Thank you for, looking through. Maybe I encourage everybody on the call to know your vaccine status and reach out to your healthcare provider or public health to determine what your status is and to ensure that you're protected. And so I had, if any questions, so I'm looking to Rob. Is there anything that's come in about this very quick presentation?
I'm not seeing anything right now. So maybe let's just move along for the time being, but we can absolutely come back to it following the next presentation if anybody has any questions for Denna. So with that, I would like to introduce Josh Cole from Silver Fox. Welcome and thank you for joining us, Josh. Josh is responsible for customer relations and business development with Silver Fox, and I will pass it over to him to introduce his team members that he has on the call and to talk a little bit about their services.
Thank you so much, and thank you for the opportunity to be here. We are thrilled to have this opportunity. It's not common that we can speak to a group before coming on board and working with the homes and having the pleasure of servicing you. So we really appreciate this opportunity. I'm Josh. I am one of the partners at Silver Fox Pharmacy, and we have today with us Savita Dhaliwal, who is the clinical pharmacist supporting the 3 Grey County long-term care homes, and Tamara is the customer support representative manager. So she oversees customer support. And Diane Langdon as well, together with Tamara, they oversee the customer support. So for tonight, Savita would like to share the clinical support that she offers and works with the homes. And Tamara and Diane are happy to answer any questions with regards to anything, statements or billing or any other questions that may come up. So just a very quick intro in terms of Silver Fox Pharmacy. Um, the reason we're so excited is because I think going through the process of Grey County long-term care homes looking for a pharmacy and then us responding, it was very apparent that our cultures are aligned. And when you talk about Color Your Way in particular, I think through and through how we work and how we support the team and how we support the residents and the families, um, from management to the frontline staff, we really do, to the prescribers, to everyone that's involved, we really do take the customer support as a part of our culture. We're family owned. 100% of the long-term care organizations that we service are independent and municipal, many of them not for profit. So we're aligned in that way because our culture, again, is to be very customized in terms of what the Grey County homes and the families and residents are looking for. Um, our team has been working together, our ownership and management team have been working together for 20 plus years in senior care pharmacy. So a lot of experience in long-term care and senior care. We service retirement communities as well. So, we in 20 years, we've really been able to enhance and progress the service model and have the flexibility to service the homes according to their needs today. We know that things are rapidly changing in this space in particular, and for us to just have an ear on the ground and be involved with committees and understand what the requirements are in long-term care. That's our specialty, and that's what we do. We are not a retail store. We specifically service long-term care and retirement communities. So that's our focus. So with that, I'll also mention that we already provide service and delivery to Southampton, to Collingwood. So we're currently in the area. So just to give you comfort that we're already providing service in the area. Um, I think with that, I'll turn it over to Savita and really appreciate this opportunity to grow a partnership with the team at the Grey County Homes and together with the residents and families as well. So Savita, if you can share your clinical support, that would
Yep.
be great. Thank you.
Okay. Hi, everyone. My name is Savita. I'm the consultant. So as Josh mentioned, I'll be the consultant pharmacist for the 3 sites. So just a bit of my background. I'm a board certified geriatric pharmacist and a certified diabetes educator. And I've been working in long-term care for about 9 years now. So from our pharmacists and how we support the home, we support it through routine medication reviews. So we try to optimize drug therapy for each resident and ensure that their medications are tailored to their needs. People are not on unnecessary medications that are not indicated. We also have a pharmacy liaison who I work with, who will be coming in to do monthly audits of the home. So they'll check the medication system, make sure that there's no expired medications in the med cards. The staff are following the process and policies. They'll also do a resident chart audit to make sure that orders are being processed, controlled substance audit, MedRec audit for new admissions. Myself, I also attend the home's interdisciplinary team meeting. So if there's any falls committee meeting, responsive behavior meeting, pain management committee meeting, if pharmacy input is required, I'm happy to provide that. I also attend the quarterly PAC meetings to go over any pharmacy data, med incidents, and any home updates. We provide education, so both clinical and policy and procedure education for staff. So if staff feel like they need education on a certain topic, we're happy to help. We also help develop order sets for the home. just to facilitate ordering certain medications. So we provide like the admission order set to help with new admissions, and then an end of life order set if someone ever requires palliative care. We also facilitate Tamiflu ordering. So in case the home does go into outbreak, Tamiflu ordering is done through pharmacy through a medical directive. So staff are not having to scramble to look for Kraton clearances or get orders from doctors. And we also help with Paxlovid dosing in case there is someone who has COVID-19 and they require Paxlovid. So we help manage that dosing and any drug interactions. We also support homes with infusion-related needs. So those that are not supported through Ontario Health will help provide any equipment and medications for infusions. And then we also have a partnership with Argento. So if someone is on medical cannabis, we can help facilitate obtaining that.
I think that covers it. Thank you, Savita. That's great. And again, we have a dedicated team who supports the Grey County homes, and that's our model. So we want there to be consistency. We want Savita. We're excited for Savita and the pharmacy liaison to grow that working partnership together and get comfortable with each other and be able to work closely together to optimize resident care. With that, I don't know if there's any questions or if that'll come at the end. I guess
All right.
I see there is one question here.
Yeah, I do see one question here. So just a reminder to everybody else on the call, if you do have a question, you can drop it into the Q&A. The question that we do have here, I think maybe Jennifer, you can speak to this one. So why the need to change the pharmacy service providers? What will be the benefit to residents of our home?
Great, thanks for that. And thank you for that question. When we're living and breathing these kinds of changes, we sometimes forget that everyone doesn't know why we're introducing a new pharmacy. So there's a couple of reasons. So under the ministry, the Fixing Long-Term Care Act, which I hate to say the whole name, but the Long-Term Care Act, every long-term care home is required to be in contract with pharmacy services. So that's one of the requirements. And then we're a municipality, and so we have procurement policies, and part of that procurement policy is to have an RFP process, a request for proposal process. So the contract with the current pharmacy, CareRx, has expired, which then launches us into the RFP process, the request for proposal process. And there's a number of reasons that municipalities have these kinds of procurement policies and practices in place. The two that I want to highlight, one is about fairness and ensuring that there's opportunities for providers, services, small businesses, large businesses to have a chance to put in their proposal of the services that they provide. And the second reason is around ensuring that there's an opportunity to update contracts to make sure that the agreement that's in place meets all of the needs of whatever department is implementing that contract. So in our case, gives us an opportunity to check in with the legislation, make sure that all of the services that are important to us as the operators, important to the residents, important to the families, that those are all a part of the agreement with the service provider, and in this case, the pharmacy. In terms of how it will benefit the residents, I know that Diane is going to give an update as well from her perspective. I think Josh on the relationship with families and residents and what that looks like, and we can have an opportunity for Q&A. But big picture, 30,000 foot benefit to the residents is that we have an up-to-date contract that aligns with our values at Grey County Long-Term Care, that ticks all the boxes of requirements under the legislation, and we're confident ensures that residents and their families are getting the services that they want and that they need, for particularly for pharmacy.
Thank you. So we have Diane and Tamara. I believe Tamara will give the overview in terms of that relationship from the customer support piece. Just to preempt that, I will say that over the years we've adopted a model where those who are pharmacists, clinical, are really focused on the medication needs of the resident. And Savita comes on site. She works from a clinical perspective, but we do have the inside team as well who are processing orders. We utilize advanced technology. So we have systems in place for medication verification. There's a lot that we do on the back end in terms of really to get the orders out to the home in an accurate way. So that obviously for the health of the resident, that's obvious, and of course it helps the staff who are administering those medications because it's just a safer system. So again, as a non-retail store, all of our systems and operations are designed specifically to process orders for senior care in long-term care and retirement. Um, so from a clinical medication perspective, the pharmacists and the registered team really are focused on that piece to check for therapeutic um, uh, potential interactions, etc. Customer support is a separate department because they're not clinical. They're focused on the coverage and assisting residents and families and to build that relationship with the family directly. So we always, with a dedicated rep, we always encourage that communication directly with pharmacy because it allows the Grey County staff to do what they need to do in caring for the residents and real in reality we are your pharmacy provider, so we are working with families and residents, and we want to establish that communication. So with that, I'll turn it over to Tamara and Diane, and you guys can fight out who wants to talk, but I'll turn it over to them and just to give the overview in terms of how that customer support piece works when we start with a new contract as well as ongoing.
Okay, my name is Tamara. I'm the customer support supervisor at Silver Fox, and I just took over from Diane Langdon, who's with me today. So she's joining me as well, and she has a ton of experience in pharmacy. Um, so, oh, I'm just told that my camera isn't on, so I do apologize for that. I'm sorry, I don't think my I apologize. I don't think my Wi-Fi connection is good enough for camera right now. So I'm sorry about that. Um, but I just wanted to say, first of all, how excited we are to be providing the customer service to Grey County now. Um, we have actually started reaching out to all the residents because we're starting next week with Rockwood Terrace, and we've been really enjoying the phone calls so far. Everyone has been like so kind and welcoming as we've reached out to everyone. So we want to say a big thank you for that. So just to let you know a little bit about our process in customer support, when new homes come on with us, we like to reach out and give an introductory phone call so you know who we are. So we each have, as Josh mentioned, a dedicated representative for each home. So for Rockwood Terrace, that's going to be your customer support rep, Kim. For Grey Gables, that's going to be Megan. And for Lee Manor, that's going to be Regina. So each of them has been busy making phone calls to reach out to all the families and let everyone know who we are. And also just to get some important information from the families about the file. So we like to find out if there's anything we should know for billing purposes. We always bill through the Ontario government plan first, and then if anyone has any private insurance, we would bill to them next. We bill by the month at Silver Fox, which is very similar to the previous pharmacy. So there shouldn't be too much change in that regard. So for example, we're all starting in July. So the first bill will come out in August. And we let people decide if they want to receive the bill by mail or email. So at that point, we confirm the proper address, whether it be mail or email, and make sure that everything's correct so that that comes out to people properly. Like I said, we also obtain any third-party insurance information. So at that time, we could then bill directly to any third parties as well as the government. So the only thing anyone would be seeing on their bill would be items that weren't covered. Regarding that, we also let families know that we can contact them for any new medications that aren't covered by any of their insurances, or we can set what we call a threshold. So if something under $20 was ordered, we would send it right away, or if it was $20 or over, we'd give them a phone call and give them a heads up that it would be on the bill. Then we go over all the different types of payment options we can process. So it's pretty much anything you can think of in terms of payment. We can set up any kind of pre-authorized billing that anyone might like, or we can do pay at the bank. We can do it over the phone. It's really whatever people feel comfortable with. So that's the billing aspect of it. And like I said, each of the different homes has a different rep associated with them. And we like to end the first introductory call by sending out a welcome package that has a lot of information about our pharmacy, as well as information on how to reach out to the rep directly, so that you're not trying to figure out how to reach someone like on a phone tree or something. You just reach out to your rep directly at their extension, and we can solve any problems that come up or answer any questions that anyone might have. So that's really everything I wanted to go over. So I'll pass it over to Diane if she has anything she wanted to add to that.
Thanks, Tamara. I don't know. I think you covered most of it. Yeah, pretty much. We explain everything. We try not to have the families have any surprises on their bill. And that's Tamara's any non-payment or non-covered drugs. There's no dispensing fee for any over-the-counter medications. Excuse me. And obviously there's no tax when we have a doctor's order. So that's quite a savings. But other than that, I think, Tamara, you covered it all. I think it was pretty good. Unless, Josh, you're thinking of something. I will say the other thing we do is try to help the doctors with EAPs, exceptional access approval, for medications that are not typically covered.
I think I saw Dana.
So we help initiate that process. Sorry?
Sorry, you cut out. I thought you were done, so I didn't mean to interrupt you.
Oh, okay. Then I was done. And then I decided to talk about the EAPs, how we help with that process. And the families, we try to do our best.
I think the heat is getting to some of the
I was going to say, this should be the most extreme issue that we have with pharmacy services in Grey County. And it's all smooth sailing from here. But sorry, Diane, you just keep cutting out. But I think Dana, you were
Okay.
raising your hand.
Yeah, I know there is a question in the Q&A, I think probably for your team, but if you don't mind, I know this is a question that's come up with our families, and one of the things that they wanted to know is when they bring in their own products, so that there's that, looking at the cost, why can't I just get a product from Walmart, bring that in? Why do I need to buy it from the pharmacy and the cost of that? I'm wondering, and maybe that's a Savita question or a Josh question, I'm not sure, but that's something that families bring up because there is a concern about cost, but why, I know it's in the reg, but why would it be beneficial for the residents and families to understand that process when it's related to over-the-counter products?
Do you want to do that, Josh, or Savita? Or do you want?
So I can
I
get
don't.
some
Yeah.
of it. So when it comes through us, it is prepackaged in a multi-drug strip, so it's a little bit easier for staff to administer. They're not having to go look for bottles the family brought. And then, as you mentioned, it is part of their regs where all medications have to be sourced with a pharmacy service provider just so they're getting the correct medication, correct dose, however the doctor wrote it. And we do try to keep our pricing competitive. Like we don't charge more than, I'm sure Diane can answer that, but we try to keep it low for families.
Yeah, we do. Tamara, do you want to answer? No, if I should answer.
I'm not sure if Tamara is going to jump in, but I think
Okay.
the key here is that from a clinical perspective, there's definitely benefits because it is prepackaged. And again, we are not retail, so we are conscious that there are other options for families to consider. But we also partner with the home in that whole medication administration process. So storing a large bottle of 100 or 500, there's expiry dates to consider. There's then remembering to go get that specific vitamin or over-the-counter item. So those are things that we work together, and that's the benefit in general. But again, yes, from a cost perspective, I think we do understand the marketplace. We do understand when we transition, we do try to keep things consistent. We're not looking to charge more than the previous provider. If Walmart or somebody has something on sale, you may see a difference, but overall, we're pretty much in line with market pricing. And then the other thing is we're not charging for a full bottle, even though we dispense in packaging. We're charging only for what we dispense. So, in other words, when we send out a weekly supply of vitamin D, let's just say that it's per pill. So we're not charging for the full bottle and then dispensing it. It's specific to what we've actually dispensed, and that keeps costs lower as well because it's not a huge cost for the tablets or capsules, and then for any other over the counter that would just be sent with the pharmacy delivery. So, delivery is a convenience as well because we do come out to the homes every day. So, if it's winter or if there's something going on, someone can't get a product, the convenience of that delivery together with the pharmacy delivery, you have that convenience as well. And I do want to add, I did see a question about the paper statement. The answer is no. There's no charge for paper statements. So whether it's paper, email, whatever that may be, there will not be any extra charge for that. Um, and Diane mentioned working with prescribers for EAP. Our team is very familiar with the coverages that are out there. So we are dedicated to helping with obtain whatever coverage is possible. Um, and our team works together. Like they all are located together in the office. They all communicate. We have regular team meeting. So we do work together as a team internally, just so that everyone's familiar with the process and can support you better because it is that team approach. Not sure if Tamara or Dan, you have anything to add to that? We do have another question. Sorry, maybe I'm taking Rob's job here.
That's okay. I'm putting my feet up. That's fine. Yeah,
Well,
so
this one's for us to answer anyway, so
that's right. Yeah, so Karen is asking if there's a medication that does not go into a medication strip, such as Voltaren or sustained teardrops, are families able to provide these for residents?
I guess I'll leave that to the team to respond to process. I think ideally, I don't know, Savita, if over the counter is part of outside medications. Maybe you could indicate that.
So the regs state like exceptional circumstances where there's medication that can't be provided by that pharmacy service provider, would be up to like what the home policy is. We wouldn't override that. Yeah.
And if I may, it is also, as you talk, Savita, an ability looking at the residents and doing that medication reconciliation, making sure it's not contraindicated with other meds, the timing of that meds, and also the labeling that's required. And so that's part of, I think, that whole comprehensive pharmacy process that is stated in the regs. So I think for families, ideally, it would be like in terms of those rare exceptions, and that would be something they'd work with their particular home team. But from recognizing from our staff point of view, those are the other things that we try to look at it. And if it's all coming from the pharmacy, because it's all on those lists, the structure that we have from medication reconciliation, but also from ensuring that we're doing the decreasing any kinds of risk, right, with any kind of medication miss. So those are the really great nature of having all prescriptions, with rare exception, coming from that pharmacy. So many eyes and many processes are part of that to ensure it's there. So yeah, I think that's working with the pharmacy and the home to work through it all, but it's all of those variables we want to ensure are all covered. That's our quality and safety. That's the whole big part of ensuring our residents have the safest approach.
If I can jump in, Rob.
Yeah, for sure.
Something else that I hadn't really thought of, doing that kind of 30,000-foot view step back. And I'm not a nurse, so immediate disclaimer, I'm not a nurse. However, I've worked in long-term care for 25 years, and the practice of medication administration and med management and pharmacy services and all of the things, it's a finely tuned machine. So in order to make sure everyone is getting the right medication, treatment, etc., at the right time, the volumes of documentation that's required, in which is all for good reasons in terms of safety. Dana mentioned some things around now I can't even say the words, but making sure that there's no negative interactions, that things are happening at the right time. And it's not just about giving pills. It's about the overall wellness of the residents, the logistics of making sure medications and treatments are given to residents and provided at the right time. And think about it, in some cases, 150 people, however many times a day. There's a lot of logistics, and then always the safety, right? We touched on just a few items like expiration dates and We all know with our own medications, sometimes we don't, sometimes we must finish, like it's antibiotics, you must finish the course of pills, but sometimes you don't. You are told to stop if it's not working. Then we need to have a safe way of getting rid of those leftover pills. And like those are just a couple of little examples. And so our partnership with the pharmacy is also onboarding experts that this is what they do, this is all that they do, and they're experts in giving us the resources, the tools, the guidance when there's questions or challenges. And they do this work in a number of long-term care homes across the province. So they also have experience with how things have worked in a really positive way in another one of their organizations that they're partnered with. And that may help us improve the experience for the residents, but also the experience for the nurse that is trying to do all the things in a short amount of time and do it in the safest way possible. So I really appreciate the questions and the chance to kind of, this isn't just a partnership to make sure that medications are delivered to the home and we sign for them and the nurses give them out. It's so much bigger than that. And we're really thrilled that Josh and the team were interested in being part of this call to be able to, start building that relationship, because it is a relationship. I trust that people that are joining live, and if you're watching this video later, that 9 out of 10 of you, and maybe even 10 out of 10, know the name of your pharmacist in your local community. And because that's how important it is, you're going to drop by and you're going to talk to so-and-so, and they're going to help you make sure that you are taking this at the right time, or this side effect, or whatever the case might be. So just wanting to give that big picture, the finely tuned machine that is pharmacy services in partnership with our team members who make sure the residents get what they need.
Thank you for that. And I'm just going to add there is no dispensing fee for over-the-counter items. So that, I think that's important to note, just so for your comfort, that it really comes down to that cost and whatever that markup is. Now, again, we are in partnership with the homes, and it is truly a finely tuned machine. That's a good way of putting it, because there's so many different components to this. The important component to us is communication. I think that supersedes everything. And from your perspective, as a family member, always feel free to ask. Always feel free to question what we're doing, and we're happy to answer. We service about 50 long-term care homes and 50 retirement communities. So we do have experience in many homes. The items that you're mentioning, I know it's come up, but we also don't have people knocking on our door with issues about that. So we do know that we've kept things very consistent and competitive for families. And if it's something that may be slightly higher because it's on sale, but the benefit of having it in the packaging, and all the other benefits that come with it, we're hoping that people understand that. And it's not, we're not looking to be higher priced across the board. It's, we do look at that, and if there are questions about price, bring it to us and we will look at it. We, as a family organization, we are very mindful of costs, and we understand that. So we do want to work with you on that, and appreciate your understanding that it is a specialty pharmacy with a lot of different components that go along with it. So thank you for that.
Excellent. Thanks everyone for chiming in on that response. That was great. I'm not seeing any more Q&A questions in there. So perhaps this is where we will begin to wrap it up. But if anyone on this call, or again, anyone watching the recording of this call, does have a question and you want to submit that, just reply to our email that goes out, or email communications@grey.ca. If it's a Grey County related question, we'll get back to you as soon as we can. And if we need to forward it on to Josh and his team there, we can certainly do that as well and get an answer back to you quickly. So thank you, Josh. Thank you, Diane and Tamara and Savita for joining us on the call tonight. That was great. We were really glad you could make it. Jen, as always, I'll pass it off to you for the final word tonight.
Great, thanks so much. Thanks, Dana, for the overview on measles. So if anyone has any questions about that, follow Rob's instructions. Again, I'll also echo thanks, Josh and team, for being here and doing this introduction. I especially love that each of the homes has a dedicated rep, that people should be watching for the welcome package and the goal of trying for no surprises, because I think there's lots of change that comes with moving into long-term care, and the surprises on the bill shouldn't be one of them. So thanks, everyone. Happy belated Canada Day, and have a great summer. The next time we'll come together, it will be fall. So thank you and have a great night.